Depending on your surgery, you'll be sent home with a urinary catheter, also known as a Foley catheter. You will be sent home with a 10 cc syringe to help empty the catheter. To empty the catheter, you're going to attach the syringe to the green part of this specific catheter and draw back 10 cc's of fluid. That is essentially just emptying the balloon that's holding the catheter in place. Once the syringe is filled up with 10 cc's, you discard the syringe, you pull the catheter out slowly. We will have you empty the catheter every few hours after surgery to ensure that your patient is hydrated. Make sure their urine is clear color. To empty the bag, you unhook this part by pinching the green, and then you undo this clip here. You then will clip this clear clip and tuck this green back into the spot here. Once the catheter is removed, we want you to urinate within 6 to 8 hours of removal.